Hello and welcome to Askimo TV. We're talking today to Dr. Robert Greenbaum. Dr. Greenbaum is a senior cardiologist working in London, the Royal Free, Barnet and Wellington hospitals. He is a past president of the cardiology section of the Royal Society of Medicine. He treats the full range of adult cardiology and has a particular interest in coronary angioplasty and implantation of pacemakers. Hi, Dr. Greenbaum. How are you?
I'm fine, thank you. Good morning.
Dr. Greenbaum, let's talk today about palpitations and heart rhythm disturbances. What are palpitations and how are they different from heart rhythm disturbances?
Palpitations first are very common, and I probably get 6 or 8 patients a week referred to me with palpitations. And my experience is that they mean very different things to different patients. So the first thing I do is I try to clarify with the patient what exactly they mean, what it is that they're experiencing, and one can get a wide variety of replies. In general, however, it tends to be some sort of awareness of changes in the heart rhythm. With younger patients, it often turns out that they're simply aware of changes that normally happen with heart rate during the day. People commonly believe that the heart rate should be absolutely stable and unchanging, and that's actually not true. During the day, when you're up and about and walking and doing things, your heart rate tends to be faster, and then at night, when you're asleep in bed, it tends to slow down. So there are changes normal, and indeed, it's only patients with heart disease who tend to have heart rates that don't change through the 24 hours. And it's a common belief that people shouldn't feel their heart rate. And once they do, they often get very alarmed, and many of these end up coming to see a cardiologist. So to try and sort out people who are just simply aware of something that's normal from those who may have a more serious rhythm disturbance, we generally try and look for other features that may be more worrying. For example, if the patient ever feels faint or has actually fainted, then we would often take a closer look at these patients.
Who's at risk for either of these conditions, whether it's palpitation or heart rhythm disturbances?
Well, palpitations, I think people come from a wide variety, so I don't think you can sort out particular risk factors. My experience is that although it can occur at all ages, it's more common in younger people in their late teens, 20s and 30s. They just seem to become more aware of palpitations. Actual heart rhythm disturbances, as an adult cardiologist, I would see, again, people over a wide variety of ages, but generally, as patients get older, they're more prone to get true disturbances of heart rhythm. There are a group of very young people who go and see pediatric cardiologists with palpitations and heart rhythm disturbances. Happily, very serious heart rhythm disturbances are very rare, but they can be catastrophic, and we do hear of sad cases of young athletes suddenly collapsing either in football or on field sports. So they certainly do occur, but they're not something I personally encounter, and as I say, happily, they are extremely rare.
What do you feel are some signs or symptoms that a person may experience that would indicate that they should go and seek medical advice?
Well, I think if they're really worried, I think that's the first thing, because I think part of our job is to reassure. So it's not just treating major disease, but for some people it really becomes a great worry, and one can reassure people that there isn't a major problem. But I think if the patient has symptoms of feeling faint or blacking out, or becomes unduly breathless, or develops discomfort, pressure or pain in the chest, then these are the sort of symptoms where you really do need to see somebody and have some further investigation.
And Dr. Greenbaum, just to end off, Is it possible for a person to prevent either palpitations or heart rhythm disturbances?
In most cases, I'm afraid the answer is no, not really.
Thank you, Dr. Greenbaum. Thank you so much for talking to me today.